The economic downturn currently ravaging the country is taking a toll on the health sector, particularly on private medical service providers, as the cost of drugs, injectables, hospital equipment, and other consumables have increased significantly. To this end, patients are now resorting to patronizing unlicensed and low-quality healthcare centers at the risk of their health. The report.
According to the Nigerian Health Watch in February 2024 report, an estimated 70% of the population in Nigeria seeks health care from the private sector, as private medical practice is often preferable to people due to the poor quality of care in the public sector. However, there are still a number of issues related to the private healthcare sector that have not been properly addressed, especially the dwindling human resource.
As the crunch is actually going on, a lot of doctors and practitioners, they have been forced to downsize because of what, low revenue generation. Okay, because they're not able to, to recoup their investments. Okay, because of people are not able to afford the usual medical treatments that they previously do.
For the many who patronize private practitioners, the rising cost of services, drugs and injectables is taking a toll on them.
I use private sector for my health challenges, and it's not easy at all, because seeing the doctors getting drugs from the private sector is very, very tough. I mean, very cost. And sometimes when you don't have money, you will not be able to have access to the doctors.
Sometimes the charges are over triple, like more than triple the charges, both accessing the hospital or pharmaceutical, is more than triple. The things you usually buy maybe at the rate of 2,000, 5,000, today it goes for 15, 25,000. Is that very bad?
Accessing doctors privately, it's becoming more expensive by the day. By the government hospitals, they're cheaper, and it's, even though it's difficult to access the doctors, but you end up spending less. And the disadvantage is just that sometimes you need to see them and they are not on seat. You understand?
The impact that it has on hospitals, it's actually bearing so much effect and pressure on even practitioners. Some doctors are not even able to be able to purchase their usual medical supply in the right quantities.
Some private medical practitioners say a merger by private hospitals, subsidies for power and medical equipment, broadening the National Health Insurance Scheme to accommodate more people, establishing a bank for the health sector that would attend to the funding needs of health institutions, among others, will enable the sector survive the economic onslaught.
The idea of merging would have been a very fantastic one, but then it's not common here in Nigeria. People just want to do their own thing, make their own money. They don't see the benefit of collaboration, and then sharing profit, which I totally believe in, and also I agree that times like this, clinics should be willing to merge so that they can be able to bear the financial pressure on them. Okay, so a lot of people are left with the option of going to seek for such kind of medical services at mushroom hospitals and clinics, and it exposes them to the danger of losing their life.
Issues around healthcare affordability and accessibility, stakeholders says, call for immediate solutions to achieve optimum healthcare outcomes. Aisha Salihu, Trust TV News, Abuja.